I'll always remember exactly when I started with Merlin and when the tsunami hit, because both were at the same time. So I junked all my plans and got stuck straight in. I kept hearing about how too many agencies were running around not knowing what to do. But Merlin went straight to work with the local health staff and the local communities, and that made us stand out, particularly on the ground. That's why I joined Merlin, and I knew I'd made the right decision at that point. And since then, I've seen time and time again how this makes us special, how this is the right way to work. In Sri Lanka, we reached 300,000 people affected. But what I will remember most is that in Ampara Hospital, which I saw just a few weeks after the devastation, 3 in every 10 babies were dying of infections. We reduced that to 0. No babies were dying. We then went on to work with government to implement the measure in every single hospital. And of course training was key to that. I visited Indonesia 3 years after the tsunami, and I saw the clinics that we rebuilt them to disaster standards, which means they should not be destroyed again. But most important was that we strengthened the delivery of healthcare. Many health staff had lost their lives, so we trained more, and left a legacy of 500 trained health workers and 240 trained midwives. I met many of them, and they were so proud to be working in these facilities, and told me what they'd achieved. Merlin works at every level. We worked in Myanmar, where the Delta was hit by the tsunami, and trained over 500 community health workers. When Cyclone Nargis hit a few years later, they went straight to work. Their local knowledge, their position in the community, really helped us have such a strong impact at grassroots level. But we also worked at a much higher level. We worked with the World Health Organization and co-led the health response of all the agencies to make sure that we were all coordinating. So this time there was a much more effective response. Lessons were learnt for the tsunami, and we helped to implement them. Merlin has a unique way of working, in partnership with the Ministry of Health, strengthening health systems, training health workers, working long-term to protect communities from disasters. Work really does have a lasting impact, even all those years later. With your support, we can make change happen. We will have to do this again and again. As you have seen, change can happen, even in the most difficult circumstances.